Alright, standard precautions are in place, and for the amputation skill, this bandage is placed so tightly in a lot of instances it will cause your classmates' fingernails to dig into their palm. So as a courtesy to them, it's a good idea to pad the palm before you start the skill. Alright, the amputation is a source of significant bleeding. So we're going to control the bleeding by applying ABD pads or 4x4 gauze over the stump and applying direct pressure. As soon as the bleeding is controlled, if you have a conscious cooperative patient or a partner, they can then hold the dressings in place as you prepare to put on the figure 8 bandage. We're going to use at least 3 different rolls of Kerlix, and you can use more than that if you want. We're going to begin by applying a lock loop here around the wrist, or as close to the stump as you possibly can, and we're going to try to create something that looks like a boxing glove to hold the bandages and dressings in place. Okay, that's fine. It's a good idea to pull when you have the Kerlix out to this point, and each time you pull, it's going to apply a little more pressure there at the source of the bleeding. Alright, take any loose ends, tuck them, or tape them as necessary. And as you can see, it ends up looking almost like a boxing glove. The next step is to take a separate Kerlix, and we're going to create a figure 8 pattern over the top of the forearm. So we take our Kerlix, begin by creating yet one more lock loop here at the wrist, come out directly over the end of the stump. Many students try to go under here or around, but you want to be right here at the very end of the stump. Make sure the elbow is at a 90-degree angle, and go in a figure 8 pattern over the top of the forearm. Where you get to this point, give it a tug. Make yet another figure 8. When you get to this point, give it a tug. Wrap it around the forearm again, and tuck any loose remaining Kerlix in. Now you should end up again with a figure 8 over the top of the forearm, and we're now going to take one additional Kerlix, and we're going to place that down onto the forearm, which will pull pressure here at the very distal point. So we start with one final lock loop at the wrist, and we simply go down the forearm, pulling the figure 8 down onto the forearm itself. And of course, loose ends are always tucked. Okay, we're still not done, because what we can do now is use gravity to help us control bleeding even further. We want to try to keep the stump higher than the level of the patient's heart, so we're going to create a sling and swat. Take a triangular bandage, open it all the way up, and we want the right angle, or the corner as it's called, to point down toward the ground. Alright, lift the patient's arm up, place it in the armpit with the corner pointed down at the elbow. Pull the Kerlix, pull the triangular bandage towards you, and wrap it around the patient's neck and tie it on the side. It's always a good idea to tie knots on the side for patient comfort, and if possible, tie using a square knot. Alright, just relax. Once the patient is relaxed, gather up the excess, and you can either use a safety pin or simply twist it and tie it in a knot here to form a pouch in which the elbow rests. Okay, we're now going to take 2 other triangular bandages, open them up and keeping them nice and wide. We're going to go under the uninjured arm. Using a square knot, tie it down to the body. Are you breathing okay?
Yes.
Take a second Kerlix, again go under the uninjured arm, come right underneath the amputation stump, snug it down. You breathing okay?
Yep.
Take a deep breath for me. Okay, that's good. All right, so this should keep the bleeding controlled. We're still not done with this skill though. We have to find the amputated part. We're going to clean it of any gross debris using as best a sterile technique as we can. Irrigate it with sterile normal saline. You then wrap it in sterile gauze, moisten with sterile normal saline, place it in a plastic bag and seal it. You then will take a second plastic bag, put either ice or perhaps chemical cold packs in the absence of ice in the second bag, place the first bag in the second bag and seal it up. The idea is that you never want the water to melt from the ice and then contaminate the amputated part.